listening to What's Your Wrinkle with Dr. Arthur Perry. What's your wrinkle?
We have a great guest tonight. We have Dr. Russell Langan, who is a surgeon, and Dr. Langan is a surgeon who takes care of some of the most difficult cases in all of medicine, and that is liver surgery. And liver surgeons are highly trained surgeons, and Dr. Russell Langan is an expert in surgical oncology and what's called, you ready for this one, hepatopancreato biliary surgery. Almost hard for a doctor to say. And he's at the Saint Barnabas Medical Center in Livingston, New Jersey, and he's at the Robert Wood Johnson University Hospital. They are both Robert Wood Johnson Barnabas Health Facilities, and it's now called an RWJBarnabas Health Facilities. He's also affiliated with the Cancer Institute of New Jersey. Now, 40,000 Americans in the United States, 40,000 adults are going to be diagnosed with liver cancer this year. And this disease is fatal in many of those patients. Liver cancer has been steadily rising in this country. It's very aggressive, and sometimes the symptoms don't show until they're very late. Well, March is National Colorectal Cancer Awareness Month. I'm sure you all know that, right? You might be wondering what colon cancer has to do with liver cancer. It's up to 70% of colon cancer spread to the liver. So Dr. Langan will tell us how to prevent liver and colon cancers and how he diagnoses and treats those cancers. Dr. Langan, thanks for joining us.
Good evening, Dr. Perry. It's truly a pleasure. Thank you for having me.
Well, thanks for taking time in your Saturday evening. So you are such a highly trained doctor. I know you've trained all over the place at Sloan Kettering, at the National Institutes of Health, and I'm so happy to have a true expert in this on my show tonight. So tell us, what is liver cancer? How do people get it?
Again, thanks for having me. So you really need to break liver cancer down into cancers that start in the liver and then cancers that spread to the liver. So cancer that starts in the liver is called hepatocellular cancer or cholangiocarcinoma, and those are just big words to say that that cancer started within the liver itself. And the reason that we're talking about colon cancer tonight as well is that many colon cancer patients can have tumors that then spread to the liver, and we call that secondary liver tumors. Those cancers that start in the liver, those are usually associated with alcohol abuse that can lead to cirrhosis, which is a scarring or a chronic inflammation of the liver, or chronic hepatitis B or hepatitis C that can also lead to cirrhosis. Or actually now in this country, it's become quite an epidemic, is what we call fatty liver disease. And that has become the number one reason to actually transplant someone in this country. Fatty liver disease also leads to cirrhosis. And once you have this cirrhosis of your liver, that causes a reaction that can lead to a cancer. So just to summarize, there's really two types of liver cancers, those that start in the liver or those that move to the liver, for instance, like colon cancer.
All right. So let's say someone has someone in their family that has a cancer in the liver. How can people prevent themselves from getting a liver cancer?
So you have to look at it in two ways again. So if you're looking at yourself, this will sound a little bit like a cliche, but it's monitoring and doing proper liver health. And what that means is using alcohol in moderation, eating a well-balanced diet, and managing obesity. And if you're an at-risk group, if you're a high-risk group for hepatitis B or hepatitis C, you should be screened for that. And let me say one thing on that point. Starting this month at Saint Barnabas Medical Center, one of my colleagues, Dr. Sue Wang, has a CDC grant that's opening to screen patients through our ER or our inpatients for free for hepatitis B or hepatitis C. Now, in the past and at other institutions, when you find that you screen positive, what do you do with that? Many of those patients can then be lost. But we, in conjunction with the Center for Liver Diseases and Liver Masses at the Robert Wood Johnson University Hospital, have opened up a comprehensive liver center at Saint Barnabas Medical Center so that if a patient happens to screen positive, we set them up with a team that will get them treated, get them screened for cancer, and learn to how to prevent further health complications related to that hepatitis screening.
You know, that's such a great thing. And for listeners out there, the word hepatitis C just 2 years ago was, you got shivers when you heard if you were diagnosed with that. But now, as you know, Dr. Langan, it's a curable disease thanks to researchers like yourself. It's really quite a remarkable change in medicine, and one of the many understated advances in medicine. So, all right. So now, I know that there are things that we can do by, let's say, drinking less, but are there foods that we can eat to improve our liver health? You hear these ads on the radio for these supplements and things, but what's the truth about all this?
I can't speak too much on the use of supplements. Most high-volume cancer centers do not take a stance on that just because we don't have the data to date to suggest that a supplement will cause one thing or another. But as I said, it sounds like a cliche, but it's really eating a well-balanced diet, limiting the intake of red meats, increasing the intake of fibers, using more vegetables and fruits and whole grains in your diet, and then also exercising about 30 minutes a day. Believe it or not, it goes a long way. It can cause you to lose weight and decrease your body mass index. And we talked about limiting alcohol and, of course, limiting smoking and the use of tobacco. And for the listeners out there, if you're actually curious about this and you want to learn more about digestive or specifically colon health, Saint Barnabas Medical Center actually has an upcoming program called Colon Cancer Screening and You, When and Why, and they're going to be holding that on March 21st from 6 to 7:30 at the Barnabas Health Ambulatory Care Center in Livingston, New Jersey. And you can call and get information on this. The number is 973-322-2671. So, generally speaking, our institution really tries to reach out into the community. We want you to be coming in and talking to us. I've held events in the past right in the hospital where you can come in and we talk about things like pancreatic cysts or liver diseases or GI health. And it's really important. You need to take control of your own medical fate.
All right. So at the RWJBarnabas Health Facility that you're at, there is a colon cancer screening. I'm going to say this again. So if you're listening out there and you're interested, call 973-322-2671. That's 973-322-2671. It's at the Barnabas Health Ambulatory Care Center in Livingston, New Jersey. And you have to register for the event. So once again, it's March 21st from 6 to 7:30. And I don't think you're going to get a colonoscopy on that evening, but you're going to learn a lot about colon cancer. All right, so now we're talking about liver cancer, and of course colon cancer comes up. Why should people get screened for colon cancer when we're talking about liver cancer?
So if caught early on a colonoscopy, those tumors can be cured, and you can avoid the potential liver cancer. You can avoid that colon cancer spreading to your liver. And this was published in, I believe, the Lancet in about 2009 or 2010, that if you get regular colonoscopies at the appropriate screening rate, your risk of death from colon cancer is statistically less. So it's exceedingly important to get that colonoscopy at the time interval that you are supposed to. And usually that's at the age of 50 for the average American, or if you are from a high-risk family, sometimes it's 10 years before the earliest family member, and you should certainly bring this up with your primary care physician.
And very important advice. And a lot of people think that colonoscopies are a real pain in the... Oh, wait, I'm sorry, we won't say that on the radio. They're not. They're quite simple. And I've had a number of them, and I enjoy them immensely. And
safe now.
And they really are. I'm speaking with Dr. Russell Langan. He is an assistant professor of surgery at Rutgers Robert Wood Johnson Medical School. He's at the Cancer Institute of New Jersey. He's at Saint Barnabas and at Robert Wood Johnson. And this is the RWJ Saint Barnabas interview that we're doing here. And I just wanted to give, once again, that Barnabas Health screening for the colon cancer, as we are running out of time. The phone number is 973-322-2671. That's 973-322-2671. Dr. Russell Langan, I really want to thank you so much. You've been a wonderful guest. You've got a wealth of information. I'm going to have you back on the show again. Thanks so much for taking time on your Saturday evening.
Pleasure. Have a wonderful weekend. Thank you very much.